I am Dr. N.K. Venkataramana, Founder Chairman and Chief Neurosurgeon of Brains Super Speciality Hospital. Brains Super Speciality Hospital has established a state-of-the-art center for spine. Spine is an important neural structure that is the continuation of the brain and the body, and all the communications from the brain goes to the body through the spinal cord. Similarly, all the feedback information from the body goes to the brain through the spinal cord. So, there are a lot of structures around the spinal cord which can cause a variety of problems starting from childhood to adulthood. Now, in the childhood itself, there can be a lot of developmental abnormalities. Children can be born with a swelling over the spine, open spinal cords, we call it as meningomyelocele, and a variety of spinal cord problems can be seen right from the birth all the way up to the old age. Now, in the childhood, we see most of them is the defects in the development. In the young age, it is the trauma related to the activity, sports and injuries. And then middle age, again the injuries, and there can be spinal cord tumors related to the spinal cord, nerve tumors related to the membranes around the spinal cord, like the brain has the membranes, spinal cord also has membranes. The bone around the spinal cord can also cause tumors. And then we have a lot of mechanical problems like disc prolapse, joint problems, joint and spondylosis. When with age, there can be wear and tear problems with the spine. The wear and tear can be in the bones, in the ligaments, in the disc, causing a variety of problems called spondylosis, spondylolisthesis, dislocations, etc. So, time to time we need to look at the spinal cord health. Fundamentally, the way to look at is that you used to have a regular checkup, and today Brains Super Speciality Hospital has got a imaging system where both the CT scan, which can image all these bones and the structures, MRI, which can image the discs, ligaments, joints and the soft tissues including the nerves very beautifully, and identify all the anomalies and defects and the deformities and degenerations as well. And most important thing is that we have a 3D imaging system in the surgery operating room. So, wherein whenever we are doing spine surgery, we can get a 3D imaging of the spine. A surgeon can get oriented so well that we can do a perfect surgery. The perfect surgery of the spine is very important because spine is an absolutely delicate structure, very delicate, and any slightest mistake or any slightest deviation from the routine protocol can lead to a lot of problems. Number one. Number two, the blood supply to the spine is very delicate again. Any compromise in the blood supply can lead to spinal cord malfunction. And third thing, the spine is a mechanically active structure. It is important for the mobility and stability, and ultimately that is the one which will give an individual the ability. So, all the three need to be maintained either before and after the surgery. There is a lot of myths after the spine surgery. Patient will be immobilized, patient cannot do work, patient cannot be moving around. All this is wrong thing now. The spine surgery has become very sophisticated. The intraoperative 3D imaging gives us a absolutely clean image of the spine, where we can, if we are doing an instrumentation or placing an implant or doing any kind of surgery, can be done very perfectly. Microsurgery has become absolutely safe. Any tumor inside the spinal cord, not only outside in the spinal canal, but also inside the spinal cord, called intramedullary tumors, can also be safely removed today. So, there are a lot of gadgets, and intraoperative neural monitoring is the most important sophisticated equipment that keeps guiding the surgeon while operating how much disturbance that is happening in the spinal cord, conduction and the electrical distribution. So, accordingly we can take decisions how much to meddle, how much to remove, how much to intervene in the spinal cord integrity. So, the sophisticated surgery today makes the spine surgery very safe, and we mobilize the people within the third, fourth day itself, and everyone should have rehabilitation so that they regain their strength back immediately and they get back to their original work. Except in few specific situations, most of the spinal surgeries, people can lead a normal life, rather more active life after the surgery, because their pain is reduced, their mobility is improved, stability is gotten better, and they can lead a normal life. That's the purpose of all the advancement of the implants, microsurgery, gadgets, intraoperative imaging and the surgical skills.